start. So good afternoon, everyone. My name is Lisa Lee. I'm the Dean for Student Services and Enrollment Management at the New York College of Pediatric Medicine. Thank you for joining us this evening or this late afternoon. If we can go to the next slide. With us, we have experts within the Pediatric Medicine Residency. Dr. Schneider, if I can have you start and introduce yourself.
Sure. I think it was a lot younger in that picture too. So you don't have one of me at NYCPM, but thank you very much. So my name is Harry Schneider. I practice in Cambridge, Massachusetts. I'm the residency program director here. I graduated from NYCPM in 1999, as it says here, and I've kept my ties. I think I've been back to the school every single year except one because of COVID. But I do enjoy my time coming back and seeing the facilities, but more importantly, seeing friends that I've had there now for 25 years. So welcome everybody, and hope you'll be part of the team as well.
Thank you. Dr. Bernatsky?
I'm Dr. Adam Bernatsky. I work at University Hospital in New Jersey. I went to NYCPM class of 2016 and then actually went on to do my residency there as well. Went and did fellowship at University of Louisville in a combination of kind of like reconstructive foot and ankle and trauma. And then went actually back to the school as an attending for about a year before I took my current position. And so I'm looking forward to talking to you all.
Thank you. And Dr. Stallings?
My name is Will Stallings. I recently graduated NYCPM this last year and then matched to Yale New Haven Hospital, where I'm a resident there now. Working a lot, love it, but residency is a lot of work, as these other phenomenal attendings could attest to. But like Dr. Schneider said, something I like to do, and I could see that Dr. Bernatsky does the same, who actually, Dr. Bernatsky, I don't know if you remember, but you were my first attending when I was on, what is it, clinical skills?
Yeah, I do remember actually.
Yeah, you started speaking Spanish to the patients. I was like, "Do you speak Spanish?" She's like, "Nah, I know a little bit." It was funny.
Yeah.
But yeah, long story short, is something like I have a passion to giving back and staying connected to NYCPM, which is awesome because they were great to me, and I'm happy to be here and talk to you guys.
Awesome. Thank you, Dr. Stallings. And actually, just for our attendees, our webinars are meant to be interactive. So feel free to put your questions into the webinar chat box, and we'll try our best to get to all of your questions. That said, why don't we just start out with some general information. So maybe going backwards with Dr. Stallings, if you can share with us how you got into pediatric medicine and how you ended up at NYCPM.
Okay, so it's a long story, but I'll try to give the abridged version as much as possible. So as a high schooler, I really didn't see myself wanting to go to college in the first place. I was into sports. I was like, I'm just going to do sports, athletics, etc. I went to whatever college would give me the most money for my sport. I got hurt and then started focusing on my academics. I started looking into athletic training because, again, working with athletes, started looking at physical therapy. And then somewhere along the line, somebody said, hey, you should check out pediatric medicine. And I looked at MD and DO as well. And they said that pediatric medicine, like, you could do the same things you want to do as an orthopedic surgeon, but it's half the residency time. And something that was always pretty daunting to me was like, I don't know if I want to be in school forever. I don't know if I want to be in residency for these large numbers, 6-7 years, et cetera. So I checked out pediatric medicine, did my research, and found that it would offer me everything I wanted out of the field, which means diversity, patient population, and again, that working in that sports medicine athletic population. So I applied, I got in, and from the moment I got to school, I made my education centered around sports medicine, and I'm still doing the same. So that's my spiel.
And then why NYCPM?
Oh, I mean, there was no other option. I mean, it's the oldest school. It graduates 25% of all pediatric surgeons and pediatric medical doctors that's practicing. I grew up in New York. It was well known in the area. I went to college in New York, and it was well known in the area. And when I say it was the only option, it legitimately was the only option. People were like, yeah, you're going to go to podiatry, NYCPM. It's right there, has everything you want, has all these accolades. And I said, all right, cool. It was the only pediatric medical school I applied to, actually. I applied to MD, DO, and this was the only pediatric medical school, and I chose NYCPM.
I did not know that.
Yeah. I didn't want to go anywhere else. Yeah.
Um, okay,
Yeah.
Dr. Bernatsky?
So I kind of was initially started off as a pre-pharmacy major. My uncle owned a pharmacy. I decided that's what I wanted to do. I went to the University of Florida, and my uncle kind of was like, "Hey, owning your own pharmacy isn't really possible anymore." And I really wanted to do something clinical. And so I kind of was exploring around applying to MDs and DO schools, and one of my friends was like, "Hey, why don't you check out podiatry? I'm checking it out." And it was somebody that I was in classes with, and I went and shadowed a couple podiatrists and like doing ankle fractures and other things. And I really loved what they were doing. They were my family friends. I didn't even know that they were podiatrists. And I remember that they were, at their kids' soccer events and at sporting events and things like that. And so for me, it kind of fell into my lap of like, I wanted to do something clinically. I like using my hands and being like a hands-on physician. And then on top of that, seeing the work-life balance that you can achieve if that's what you want, I think kind of really led me in this direction. And so funny enough, she went to podiatry school, I think at Barry or somewhere for a month, and then dropped out and is now a pediatrician. And I really loved it, and ended up at NYCPM. I interviewed at a bunch of other schools. And for me, seeing the clinic at NYCPM and how clinical they were pretty early on, I thought was really important. And so having been seeing students coming through our residency program, I'm currently the clerkship director at our program. You really do notice. I felt like at least in my experience at NYCPM, students know what they're talking about clinically when they start and when they come over. And I think that's probably just because of how busy and how much they see in their third year. So I think that ends up being really important, where some of the other schools I would see people know, answer A, NYCPM students generally know A, B, C, D, and E when you ask them treatment options. And so I think that's really important.
And bonus, you met your wife at NYCPM.
That is true. Very true.
Dr.
That is
Schneider,
a huge bonus.
a huge bonus. Dr. Schneider?
One of the great things about being on this call, I'm realizing that Adam, I know your boss, and Will, I know your boss as well. So
Yeah.
it's always kind of fun to see some faces and know that I've been around long enough to know those. So my story is probably a little similar too. I have a family of doctors and pharmacists also. Father's a pharmacist, my grandfather's a pharmacist, my wife's a pharmacist, my mother-in-law's a pharmacist. And my parents actually told me not to go into medicine. And, it's one of those things as a kid, you have to go against your parents' wishes. And I said, no matter what, I'm going into medicine. And so when I was growing up, I was the kid who had the pill counter as his toy growing up, from the pharmacy. And I said, I'm either going to be a doctor, I'm going to be a pharmacist, which now being a pharmacist, you are a doctor as well. And I had the luck of in high school, I was able to shadow different people in my mom's hospital. And so as a high schooler, I would get up, really early in the morning on weekends, and I shadowed cardiology and ENT and the ER and everything you could possibly imagine. So it increased my passion of being in the operating room, but also being in medicine. And then two things happened after that. One, I had to see a podiatrist for paronychia, for an ingrown toenail, and I was studying organic chemistry. And the podiatrist looked at me and said, "Cool, a benzene ring," and drew a benzene ring. And I said, "Wow, if he can remember that, he's really smart." And that's kind of what I want to be. I want to be somebody smart that remembers things. So that's number one. The second was I shadowed a guy named Dr. Footer in Maryland. And what a great name for a podiatrist, number one, Dr. Footer. But number two, his patients loved him. Every patient hugs and kisses, and were just so appreciative when they left. I said, this is what I want. I want a combination of treating patients in the office and talking to them. I want to be able to operate when necessary. And luckily for me, that means 2 days a week now. But I want that kind of relationship with my patients. And that's what I've developed now. One of the really cool things is being around for a while. Also, my partner, my boss, was best friends with Dr. Footer down in Maryland before he came out to Boston to work with me. So we're a really, really small world. And I think that's one of the other really cool things about our profession is that we all know each other and we all help each other out, which is really, really great. Why NYCPM? I always said, I grew up in the cornfields, and I always said, I am never going to school in a city. I looked at Boston University for undergrad and said, what a city. I would never go there. Of course, I live there now. And it was one of those things. NYCPM was the only school I applied to and got in. I said, this is it. It was meant to be. This is where I want to be. Be perfectly honest, the beauty around the school was not as nice as it is now. It was a lot of empty lots at the time. Now you have that beautiful building next door that they built up over the last 20 years, and some of it has improved a lot. But I loved when I got there and I saw that people would walk down the street and say hello, or they'd give you a head nod, and they were there for you. And I think that the faculty at NYCPM was the same way. And I felt that camaraderie with the people I was there with that really made that connection. And I've now been to all the schools, and I think we're at 11 schools now. I've been to all the schools except the 2 new ones. And I still, to this day, when I have high school students and I have college students and post-backs come through, I had a student today. I had somebody who's interested in podiatry today as a patient. I will still list NYCPM as the top, even today.
Thank you so much, Dr. Schneider. Now, if you can tell us about your residency program. What makes it stand out? What's special about it? Are there any like concentrations or such?
You asking Dr. Schneider?
Yeah, why don't we start with Dr. Schneider? We'll just keep going.
I'll just keep talking. I can do that. That's okay. No problem. So what makes our program great? So to me, diversity is the answer. And that's diversity of education, diversity of training, diversity of the patients you see. So my hospital is a safety net hospital. It is not a level 1 trauma center. So Dr. Bernatsky will tell you more about a level 1 trauma type center. Ours is more of a community hospital. We treat many of the same patients that come through, but they're not going to be high-end motor vehicle accidents, things like that. We're treating a large number of patients that come from multiple other countries. 40% of our patients need interpreters. Our number 1 language is Portuguese, Brazilian Portuguese. And I think that's pretty rare. Most people it's Spanish, but for us, it's Portuguese. So we're a little bit different. We're a family. I'm working with the same people right now that I worked with 20 years ago, 25 years ago. I'm still seeing some of the same patients. So you can imagine some of the jokes that go through with some of my patients that cannot be on this kind of broadcast. We can't talk about things like that. But I've gotten to know my patients because they're family. And I'll be honest, at this point, I spend more time with these kids, meaning my residents, than I do my kids sometimes. And so I want a family atmosphere. I want somebody that I can joke with. I want somebody that I can hang out with, and somebody who's willing to learn, because if you're willing to learn, we're willing to teach you. And ultimately, what is it all about? It's about the patient and making the patient feel at home and make sure they get the best care possible. And that's kind of how we run our program. So we're not a level 1 trauma center. We're a community hospital, 3 hospitals. We go out to about 7 other hospitals. So you're going to get diversity of education as far as the number of attendings, the hospitals, because you're at multiple different hospitals as well, and then different equipment, right? You don't want to learn on one particular brand. You want to know multiple different brands, multiple personalities of the surgeons that you work with, but also the hospital employees, and then just the types of patients you operate on and you see. So you might see the poorer subset in our population, but you also get a lot of second opinions that come from Cape Cod, they come from Vermont, New Hampshire, et cetera. And on the outside, you'll get the more affluent patients, and you'll get to understand how to deal with different personalities and different types of people as well. So I think that's one of the biggest benefits of our program.
Great, thank you. Dr. Bernatsky?
Yeah, I think diversity is really important, like Harry said, and I think we definitely have a lot of diversity as well. University Hospital is also, it's a state institution, but it is a safety net hospital for our area, and so with that, we do have a very diverse patient population. We are a level 1 trauma center, so we do get a fair amount of trauma, just foot and ankle trauma in general. We split it 50-50 with orthopedics. Depending on what day it is, odd or even. And so that's all foot and ankle call, whether it's, ingrown toenails or trauma stuff. So it kind of makes it a little bit busier on certain days, but we definitely get a good diversity of cases. At our institution, we do get a lot of referrals over from inside the Newark area, whether it's revision or just referrals in general from people who maybe feel like they can't handle things. So we do get a lot of some larger cases to our institution. But the residents go to 5 other hospitals. They're on call at, I believe, one of those, but each of those are in kind of different communities in different areas. So the diversity comes from that as well, where some of the hospitals are in a little bit more affluent areas. Residents get food and all of this stuff, whereas at our hospital, we have your standard cafeteria. But I think another good thing about ours, and I think Harry touched on it as well, is we also have a pretty good family environment, and I think we pride ourselves on that as well. Our hallway where podiatry is has all the attendings offices as well as all of the residents, and their offices and all of our staff. So we're kind of all in one corridor. So we see each other every single day. So whether the residents have an outside case or a case at our hospital, they'll come and ask us, "Hey, Dr. Bernatsky, what would you do with this? This is what I have later today. Do you mind taking a look at the x-rays?" And I think that's really important. I think, having that ability to have the residents and have an open door policy, which we all have, is pretty nice. And I think the residents really take advantage of that. Three of us of the four are fellowship trained, and we all did different fellowships. One of the attendings, the current program director, did a sports medicine fellowship. I did a little bit more trauma and reconstructive. I was 6 months on an ortho trauma team, and then did reconstructive with podiatrists and orthopedic attendings. And then the newest hire did a Charcot fellowship. And so we kind of have a lot of diversity just within our own hospital. But at the same time, the residents go to those 5 other institutions with, I think, like 30 to 50 other attendings. So they're very busy. I would definitely say that we are known for being a little bit more of an intense program when it comes to residency programs. But I think, from my standpoint, the more you do, the more you see, and I'm sure the other two can attest to that. When you're in residency, the better off that you'll be. So if you are somebody that wants to work hard and you're really willing to put in the work, like Harry said, if you want to learn, we're here to teach you. And I think that's really important too. I think that's probably one of the qualities that we look for the most in residents coming through.
Great, thank you. Dr. Stallings?
So, not to reiterate a lot of what was said, but yes, we also have a lot of diversity. But something that I think may or may not be more unique to my program is that we have the backing of an institution like Yale and attendings that are very involved in the area, and half the attendings in the area graduated from Yale's program, went to NYCPM. So the resources to do whatever you want in your residency is there. So for example, somebody in the class above me has a PhD, DPM dual degree, and his passion is research. And they foster that in every way, shape, or form that they can. They get him funding, they get MPH students, they get med students to work with him and support a multitude of his research projects. So there's that if you're somebody like me who's, out the gates, like, hey, I'm really interested in this facet of podiatric medicine. It's like, all right, let's get you with those attendings. Let's make sure you're seeing those cases. Let's get you with some research projects that are already going so that you could, foster that passion that you have. And I also expressed fellowship early, and my attendings are all about resident-centric training. So if you're, about fellowship, that's awesome. Let's get you going. Let's talk about how to make yourself a competitive applicant for fellowships. Let's talk about why you want to do a fellowship. Let's talk about the different fellowships. So what I've learned is that my program is very, very good at setting their residents up for the future. And I think that's something you got to think about when you're going to a residency program, right? It's like, why are you going to residency? What do you want out of the residency? Do you want diversity, which Dr. Schneider and Bernatsky touched upon? My program also offers that. Do you want a program that's high in trauma? Then maybe you want to go to a program like University Hospital. Or do you want a program that is, well-versed in different ethnicities and patient populations and socioeconomic demographics? And that's a program like Cambridge Alliance Health that have outside affluent patients versus immigrants. So you really have to do your research and what the program can offer you. But at the end of the day, you want to go to the program that will foster the physician that you choose to be. And I think that is something that Yale showed me, and showed me as a student and showing me now as a resident. For example, like I just had a meeting with my boss. Don't tell him the sound joke. You could tell him, Dr. Schneider. And it was a meeting where he sat us down and said, "How are you liking residency so far? Is it everything you wanted it to be? What could be improved? What could be worse?" And it was a very candid, open conversation where I could, give feedback and find ways of wanting to make it better for me or highlight things that are working. And it's like, all right, let's do this. Let's try that. We'll talk about that. Let's see this. And I think that's really, really important. And yeah, and to touch upon diversity, we see everything. We are a level 1 trauma, the main hospital, and then the secondary hospital is a level 2 trauma. So Yale is I think now the second largest or the largest hospital system in the country in terms of beds. So with that, there's multiple campuses throughout Southern Connecticut, and each of those campuses start to see a different socioeconomic background, different patient populations. And the level 1 trauma center, you're going to see a little bit more of that full trauma, motor vehicle accidents, gunshot wounds, crush injuries from construction sites. We've had some like firework things when the summer comes. We have snowboarding accidents. So you see a lot of that. And then you have your level 2 where you get your more bread and butter, your forefoot fractures, your simple ankle fractures. So each campus and each location and each place we scrub with provides us with that diversity and training, which is important too. Because right now, like I came out the gates like, oh, I want to do sports medicine, sports medicine, sports medicine. But as I've trained and as I've gotten exposure to these different types of pathologies and different types of patients, I've grown an appreciation for, limb salvage, which is something that coming into it, I was like, oh, I never want to do diabetic wounds or limb salvage. But there's actually a lot of nuance. There's a lot of academia behind it and a lot of interesting ways where you could save a life or change a life. I know some people say like save a limb, save a life, and it truly is true. And that's something I've gained an appreciation with this program of being forced to see that diversity.
Thank you, Dr. Stallings. I realize many of our attendees are new to podiatric medicine, since they are mostly prospective students. Can someone answer the question or educate us on what the structure of a podiatric medicine and surgery residency is, starting from year 1, 2, and 3? Anyone? Dr.
Yeah.
Schneider? Dr. Bernetsky, thank you.
I can do it. So really, each residency program is set up differently. But generally there are requirements that you have to do, such as rotation. So whether it's infectious disease, you have to have a certain number of medicine rotations, a certain number of surgical rotations. And then after that, you have to meet a certain number of requirements of surgical procedures and essentially logs of podiatry. So a certain number of hammer toes, a certain number of trauma cases, a certain number of pediatric cases. So there is a standardization that when you go through each residency program, they have to be up to standards. And each program gets reviewed periodically to make sure that they are up to those standards so that we do have some sort of standardization when it comes to residency programs. With that being said, you just heard the three of us all say that all of our programs do some different things and get different experiences. So there is a little bit of nuances in each program, but for the most part, everybody has to meet a certain number of requirements, and whether it's rotations and surgical procedures in order to graduate. So I saw somebody asked, is it common for people to specialize in more than one thing, like surgery or sports medicine, and be limited? I wouldn't say limited. I would say you're trained in everything and you can kind of choose, where you want to practice and what you want to do. And I think that's kind of one of the beauties of podiatry is that if you want to do more limb salvage, you can kind of set yourself up for that. If you want to do more sports medicine, you can, do that. A lot of people will join orthopedic groups or like myself, be at a hospital-based employee where, we're doing everything that comes into the hospital. So I really think that there's a broad spectrum of what you can do with podiatry. And leaving every residency program, you will have hopefully the skills to do anything that you want, and then you can kind of pick and choose. But some of those things are required in order to graduate. Did that answer the question?
I think so, definitely.
I'll add a little bit to that if that's okay. Just
Yes,
one
please.
thing about that. So also being a hospital employee, one of the great things, I'll see 30 to 40 patients a day. And one of the great things about the environment we're all in is of those 30, let's say, patients, I'll have 28 different problems that I see. So it's not like, you're doing history and physicals as a primary care doctor and listening to sniffles all day because it's cold and flu season. I have 30 patients with 28 different problems, and that keeps us from being bored. It keeps us entertained. And it just goes to show you that even though we're looking at a small anatomic area, the breadth of our knowledge and the amount we can do for patients, like saving a limb, saving a life, sending somebody to the ER to make sure they get admitted so that we can get them on IV antibiotics and operate on them tomorrow. really can be life-changing and really can save their life, which is pretty cool. And everything of that from the pediatric ankle fracture that we talked about before you guys joined, to just even simple little things that somebody walks in pain and walks out feeling better. And it's amazing how many times we can do that on a daily basis. And that to me is part of the enjoyment of our profession.
Thank you, Dr.
So Susanna, to answer the question, you're basically specializing after residency. However, you have the ability to, when you go and look at residency programs, different programs are known for different things. So I would say that, if you wanted to do more limb salvage, there are programs who have attendings who are lecturing on this, who are doing more than others. If you want to do more sports medicine, there are people who are, performing more sports medicine procedures. And so as Dr. Stallings was saying, he wanted to be linked up with those attendings at some point, right? Because that's what he wanted to do. So it's more you're specializing afterwards. However, depending on what residency you go to, they may do more or less of something and not hit just the minimum requirement or slightly over the minimum requirement with that particular procedure or types of procedures. So while you can do, and even, you got to remember from our profession is, back in the day, we weren't doing total ankle replacements. So you also have the ability to kind of specialize afterwards and learn on your own. Like the people who are doing the most total ankle replacements now are not doing them in residency. And so, it's not just about where you train, it's, what you want to do with it and how you practice after that.
And on the topic of specializing, I'm going to be asking a question about fellowships. But before we do that, for residency programs, is it just podiatric medicine and surgery, or do you do rotations in other specialties?
So I could touch on that because I'm doing them and I'm almost finished with them now. There's a requirement, like Dr. Adam Bernatsky was talking about, that you have to meet, that every residency program has to meet this standard, right? They have to rotate in other rotations. For example, medicine. I did a month of medicine where I was treated as a medicine intern, right? So I was getting patients and I was managing, I won't use acronyms. I was managing end stage renal disease. I was managing cardiac diseases by myself, right? Not by myself, but like they were saying, hey, this is your patient. What's your plan? How are we going to augment these medications? And you get that level of knowledge. I was in the emergency room for a month and I was treated like an EM resident. I was setting wrist fractures with some of the plastics attendings, or I was treating the sniffles that came through. I was treating everything that came through in the emergency department. A lot of abdominal pain. You'll be surprised if you're ever in the emergency room. Like a lot of people come in with nausea, vomiting, and dizziness. So I was managing that. I learned the ins and outs of Zofran very, very well. I was doing infectious disease. I was learning, different antibiotics and their side effects and their indications. And it's more than just everybody gets vancomycin. It's, well, let's look at the sensitivities. Let's look at their past infections to see if they've gained a resistance to this drug or what their MIC was to that drug. So we really do learn how to be total encompassing physicians by these off-service rotations, which I truly value. I found medicine extremely interesting, and I think it's important, right? If we're going to walk around and call ourselves doctors, we need to be held to that standard. And I think these rotations bring us to that level. For example, I was talking to one of my friends who's a CRNA, whose husband is a practicing podiatrist, and I was on my anesthesia rotation. I just came off of it. And I was learning, I intubated 3 people today, right? And I was like, the main thing I want to learn is how to manage an airway. And she was like, my husband says the same thing. Like he's on a flight, and if they ever ask, like, is there a doctor on board? He's like, all right, I guess I got to answer, because he has that knowledge, So I think that's one of the benefits we get. So in short, yes, we do rotations in multiple facets of medicine with multiple different specialties so that we can at least have a base knowledge of understanding.
Thank you, Dr. Stallings. Why don't we take the student's question? Does it matter where you do your pediatric residency? For instance, could you practice in New Jersey if you did your residency in Connecticut? Different states have different laws pertaining to podiatry. I think they're talking about the scope of practice.
Yeah, so you can, just like anywhere else, you can go to undergrad and end up in any other state. You can do the same thing. You can do your residency in Massachusetts and practice in New Jersey if you really wanted to. I don't know why I wouldn't want to practice in New Jersey, but that's just me. Sorry, Adam. But yes, you can. I think the issue is going to be just scope of practice. So every state has different laws. For the most part, they're pretty similar. There's just a few nuances here and there that are a little bit different. But you get the education and training to do what you want when you graduate. So really the key is going to be your experiences, your level of comfort, and then getting hospital privileges in that state. So as long as you get a license in that state, and the VA is a different animal. If you work for the VA, you don't have to have a license in that state. You can just have a license. But yeah, you can end up practicing in any state. And I don't know if you guys are going to end up in a different state. You know, Adam, you were New York, New Jersey. You went to school, undergrad in Florida. I was Maryland. I did my school in New York, and now I'm in Massachusetts. So you can definitely move around as long as you have a license in that state.
Thank you.
Yeah, I still have a New York license, and I actually still have a Kentucky license. And you know, if I ever decided to go back, it's, you know, it's there.
So, Dr. Bernatsky, it looks like you have a following. We have a question from a student who's a student at one of our sister schools. And they ask if Dr. Bernatsky can expand a little bit more on the residency program and touch on clinic to OR balance.
Yeah. As a clerk, well, first of all, welcome. If you want to shoot me an email, I'm happy to talk about this on the side too, if you have any questions about the program. But really, I think our OR to clinic balance is very good. I did a lot of clinic when I was a resident on top of being in the operating room. But our clinic that you go to is a perioperative clinic. So you're seeing everything from pre-op to peri-op to post-op in the clinic, which I think is really important. It's not just that you are operating on patients and kind of disappearing and, you know, maybe asking the attending what happened, how did it go. You actually get to see all of the follow-up, which, you know, arguably is one of the more important things to learn, is how to deal with patients, right? How to pre-op them, how to pick the right surgical procedure, then how to do the surgical procedure, and then see the post-op procedure and deal with complications. And so we do have clinic approximately 4 days a week. It's only in the afternoon on every day but Monday. And so as a clerk, you know, we predominantly put you guys in the operating room, but you are in clinic some days. And there's also a wound care clinic that you will rotate through that a couple of the attendings go to. But it's very well-rounded, I think, as far as the two. With our residents, they probably do 1 or 2 afternoon clinic sessions a week, is what they'd probably average. And the rest of the time is in the operating room. Unfortunately, as a clerk, you can only go to 2 of the hospitals that the residents go to. So I think the residents now actually go to 6 and not 5, because they go to the East Orange VA. But the students are only allowed to go to 2, unfortunately. The other hospitals don't have any students of any kind, and especially since COVID, don't really want extra people around. So they unfortunately will not allow students to go there. But the 2 places you go to are University Hospital, which is with us, and then Hackensack, which is a pretty busy hospital in itself. So that's kind of what the clinic OR balance is, and kind of where you're able to go, you know, while you're at our program. But, you know, you'll get a list of all of the procedures that the residents are doing weekly, so that you can kind of see what's going on at those outside places and at the outside hospitals as well.
Thank you, Dr. Bernatsky. Dr. Stallings, this question is for you. You mentioned a fellow colleague of yours who did a DPM and PhD. Did they do a dual degree, or did they do them separately? And were they able to incorporate research in their residency?
So the colleague that I was referring to went to a school that I believe offers the DPM PhD dual degree. I'm not sure if that's something that is openly available to people, or if that's something that he made for himself while he was there. But I believe he did it at the same time. To that point, our school offers a DPM/MPH program dual degree that you could get within the same time period, so you don't have to add an additional time. I know for a fact that he had to add at least an additional 3 or more years. Was it 3 years?
I don't know. A lot of the medical schools are at least 1 year, and you take 1 or 2 years off from medical school and do it. So I don't know how the other pediatry schools
Yeah,
work.
I think it's plus 2 years. So it's
Plus 2?
4+2. Yeah.
Okay, so he had to do an addition, but he got it while he was at school there. as opposed to getting the MPH program at NYCPM, which you could do it within the 4 years. And then to the second question, also, were you able to incorporate research in their residency? Absolutely. He's published already in his first year in ACFAS journals. He's presented multiple posters at ACFAS this year. We did a dual poster together this year at ACFAS. We're working on 2 projects, one for a manuscript, one for a poster / podiatry today. He is already well published amongst his peers and as a second-year resident. So absolutely. And like I said, like our residency is all about what's the best for the resident and their resident training, right? So for example, it's like if he goes to our director and said, hey, listen, I have this research conference that I really want to go to. My director's like, awesome, let's make it happen. Let's find the money. Let's get you there, right? While still meeting your requirements to graduate your residency. So yes, he's able to do that while he's in his residency, and he's able to do a lot of it.
But
Because he has
research,
a passion for it. It's not mandatory. Just putting it out there for anybody who's like, oh, daunting. Like if you don't want to do research, there is a requirement, but you don't have to do that level of research.
but you can still do research without the PhD or the MPH.
Yes. Yeah. I like I said, I've done research already. I've published a few papers already, and all I got is a DPM. I didn't go and do the extra 2+ years. Not saying all I got, but you don't need the PhD to publish or to be well read.
Thank you. Going on the subject of fellowships, what are the various fellowship options within podiatric medicine, and is it something that you recommend for someone? Dr.
I'll start with
Schneider?
that.
Oh, thank you.
Sorry, I'll start with that. So really there's a couple of different types of fellowships, and then even within there's approval processes for each. So there are ones that are approved by ACFAS, so American College of Foot and Ankle Surgeons. Last I checked, I think there was more than 65, so the number is growing. There are ones through the Council on Podiatric Medical Education, so CPME. There's a few of those as well, and then there's ones that are just fellowships on their own that aren't really approved. So like Dr. Bernatsky's one was ACFAS, if I remember correctly.
CPME, actually.
CPME. Okay, yeah, that's what I meant. CPME. Tim Ford, right, is the director?
Correct.
Yeah. So he's CPME. So it can be through those, and then there's different topics. So there are ones that are just for research for your DPM PhDs that are interested. There's ones that are sports medicine or reconstructive rear foot and ankle. Really, in my mind, when I talk to my residents about doing fellowship, they go for one of 2 reasons. One is if they decide to do it, it's because they want to try a new area of the country. And they say, let me try working there for a year and learning more. And if I like it, I'm going to stay. So every one of my residents that went to California for a year fellowship stayed in California. None of them came back, even though they're from here. Not sure what that means, but I guess California is pretty okay. The second thing is if you feel there's something you didn't get in residency or didn't feel comfortable enough with that you want to do in the future. So our program, very well rounded. We don't do total ankles. So if you want to do a fellowship to do total ankles, or if you want a little bit more in sports medicine because you want to end up working for a sports medicine team, or let's say you have an interest in pediatrics and we get a good amount, but you want to have more, there's a pediatric fellowship in New Jersey. So it's really a matter of gaining more experience in something you're interested in or something you didn't get in residency, or trying a place to live for a year to see what you think.
Thank you, Dr. Schneider. So I guess even though Will is a resident, I think you can also answer this question as well. But what do programs look? What qualities do programs look for in their residents?
That's a good question, and it's a question that luckily I was able to join my residency team with this year's match process, and I'm sure Dr. Schneider can answer way better than I can because I'm a first year who's just had this conversation and was just on the other side of the table. But I think in general, residency programs, at least from what I gathered, want somebody who's going to work hard, who's easy to work with and easy to hang out with, like Dr. Schneider alluded to, and somebody who's going to, at least the way I look at it, is who's going to elevate the residency program, right? Whether that's by elevating the residents around them, by fostering a healthy work environment, healthy work-life balance, non-toxic environment, who's going to be producing research, who's going to be doing things like this, getting on calls and talking about the residency and helping foster the profession as a whole. And rather than somebody who's kind of just going to go in, clock in, and leave, right? Because you could do that. Any job, anywhere you want, you could go in, do the bare minimum, and leave. But that's not who I want to work with. That's not who I think residency programs want to have as a showing as their residents, as a showing of their residency. And I think that's probably the main thing I look for. Easy to work with, build the program, build themselves, and build those around them.
Thank you, Dr. Stallings. Anything else?
Yeah, I think you know, it gets asked a lot. We actually had a couple of NYCPM students come visit this week, and we're asked, you know, the same question at lunch. Some second year students came to visit. And you know, when it comes to residents, we want somebody who wants to learn, people who want to be there, people who are willing to put in the effort to learn. Because like Dr. Schneider was saying, you know, we're all here and we're all in academia for a reason, because we want to teach, we want to help out and, you know, help kind of push our profession, right? And so when people come in and you may have a lower GPA, but you came with us for a month and you worked hard and you were on time and you showed a willingness to learn, look things up when you didn't know it, and really put forth the effort and really showed us that like, hey, I want this, right? That goes so much further than students realize, versus the person that comes in with the 4.0 and kind of like walks around with their pinky up or whatever and doesn't really put forth the effort. And you can tell, right, who wants to be here and who wants to put forth the effort and who wants to learn. I think, you know, I've been using this word a lot with our residents, but being inquisitive. Like if this is what you want to do for the rest of your life, like being inquisitive about things, saying, huh, why was that? Why did we do that? And I think that's really important. I think that's something that not everybody realizes, that like, you know, we're constantly learning. I'm sure Dr. Schneider, you know, throughout his whole career is constantly learning. He doesn't do the same things that he did at the beginning of his career that he does now. And when residents come in or students come in and they want to push us too, like Will was saying, I think that's important. You know, we want to teach you, but at the same time, we want you to want to be taught and to say, hey, let's do this, let's try this. You know, we're not afraid to push the envelope on things, but we want to do it within reason, right? With our experience. But we really just want to teach students. So I think, you know, coming in with a positive attitude and really a strong willingness to learn is probably the number one thing that I look for when it comes to residents coming into our program. Whether your GPA was high or low, that may get your foot in the door, but it's certainly not going to get you a program. In my
Very similar to what I tell people. I want somebody who's teachable, who gets along well with others, and has a strong academic foundation. And, you know, as we continue on with that, a lot of what you guys are saying is very, very true. To be available and want to learn. I can't tell you how many students were like, oh, they're pretty good. You know, they come through, they're having a great month. And we do a case at 6 o'clock in the evening. We've got this, you know, pretty significant fracture and we're fixing it and we get the last screw in. And the student goes, you know, I'm going to go eat dinner, and walks out and leaves the OR. And that's right when you let the tourniquet down and blood goes everywhere. And that's the exciting part, right? That's the fun part. And they miss it because they went to dinner. I'm hungry. You know, I get very hangry at 6 o'clock. So, you know, 12 more minutes, I'm going to be very hangry. So things like that, you know, oh, a bunion. Oh, I've seen enough of those. Do I really have to go? Those are the kind of things that, you know, even if you've seen a bunch of them, fake it, right? You know, you want to be excited to see it, because I can tell you what, as a resident, the reason why we do so many procedures, because you might do 50 of the same thing and they work out great. But guess what? That 51st is when it goes bad. And that's when you want somebody who's got the experience of being there and who's done it, who's had it happen to them and can lead you through it. So that 51st case is not your first one in practice and it goes badly and you're stuck dealing with all the ramifications of that. So you really want to be there and learn, because guess what? 3 years goes by really quickly. And I'm sure, Will, they told you on your first day, these 3 years are going to go by so fast. You'll blink an eye and it's gone. And that's exactly what happens. You only have 3 years as a student at NYCPM. You only have 4 years. Learn everything you can, every rotation, every test. Go in and learn everything you can, because when you get to residency, it's all on you. You're a doctor now. You're responsible. So yes, you have attendings there with you. Yes, you have fellows, or yes, you have your senior residents, but you're now a doctor and you're writing that prescription, and you might write for something that could harm a patient. So you need that foundation, that background to know that, but you also need to be humble and ask the people around you for help when you need, because that 3 years goes by very, very, very quickly. And I still feel like I'm in that 3 years, maybe because I'm a PGY 24 and I never left. And I feel like I'm still living residency every day. And maybe that's because, or maybe that's why we call it the practice of medicine, right? We never really get there. We practice every day. We learn every day to try and get to where we can be so we can call ourselves perfect, but it never happens. So never be so arrogant that you think you're there, because you never will be. And what we're doing right now, we think is amazing. And guess what? 5 years from now, 10 years from now, just like Dr. Bernatsky said, you're going to be doing something totally different, which is also amazing. But you always want to learn. You want to be inquisitive. I love that word. You want to be affable. You want to be available. There's all these great words that people say, but ultimately you are learning for the rest of your life, and you need to remember that. So learn as much as you can while you're training and continue to learn even when you're in practice.
Thank you, Dr. Schneider. You actually touched upon the next question. Do you have any advice for students, what they can do from like year one of podiatric medical school to prepare themselves for their future ideal residency program? Obviously study hard, do well academically, but any other advice?
Yeah, I really like chocolate. It's always a good way, a little bit of chocolate goes a long way. No, I think the key is to start early. So I had a third year student with me today who was on break. I hope you guys are on break right now because it was an NYCPM student, and you're on break. Okay, good. Just making sure he's not skipping class. Take every opportunity. Yeah, you might have a week off and you want to go on vacation and you want to relax, but take a little bit of time to research the programs. I know when I was in NYCPM, we had a booklet of all the different programs. It's now online now through AACPM. You can look up the residency programs, and I divided things by location. Part of that was because my wife was in pharmacy and we were looking for her to match at a pharmacy residency or pharmacy school near where I was going to be. So we went by location. We went by Michigan and New York. Well, no New York. Sorry, definitely not New York. You guys can be New York. It's okay. We did, Massachusetts, Texas, Michigan, New York, New Jersey, whatever you want to say. And that's how I picked it. But I think the key is starting to ask the senior residents, start to ask the other residents when they come through. You have residency fairs at your school. Ask the other residents that have come through, that have graduated, that are at different programs. Ask around to the different places that are different from what you expect. You might think, I'm going to be in New Jersey. I really love University Hospital. But you know what? You might go speak to somebody who's in Kansas City. And you say, wow, I didn't even think they had a program there. That's an amazing program. And you research the numbers and see. And using the people that you know at NYCPM, at the different programs, because like I said earlier, we all know each other, right? So asking me, what do you think about this program? What do you think about this program? Because I'll know the different people there, or if I don't know that person, I'll know somebody who knows somebody who's there. So using the resources you have to find out what about each program is positive for you and what fits your personality, because ultimately there's a program for everybody and there's a student for every program. So ultimately everybody's going to match, everybody's going to be fantastic, and everybody's going to be successful, which is what we want. Throughout school, though, you really have to do well. You have to study. There's no cheating. There's forcing yourself to study differently than you've ever studied before to make sure you do well. Because even though, yes, the GPA gets you in the door, if you have a minimum GPA at a program, ours is 3.2. If you don't have that, it's really hard to get in the door. Once you're in the door, once you've done your month, the difference between a 3.6 and a 3.8 and a 3.9 is really your personality and how well you did working with the patients, because the patients will tell us how you did. Working with the nurses, because they'll also say, I really love this kid. Or they'll say, kind of had an attitude with the patient. And the patients, like I said, they will be brutally honest about every single person. So working your way through, not only through the academics and do as well as you can, but even when you get to those different externships, and I'll add one more thing about externships. So when you go out to the different programs, you choose the programs you want to go to. They might not be perfect. They might not be where you end up, but you'll learn so much at each hospital you go to. You'll learn what to do, what not to do. You'll learn different things from different residents and different attendees at those programs, but use the attendees at those programs. So you go to University Hospital and you say, Dr. Cook, who's Dr. Bernatsky's boss, by the way, hey, what do you know about Schneider and his program at Cambridge, he's going to go, oh, that guy, I tell you, and he'll be honest and tell you, because it's a small world. So use the resources you have, because ultimately we want you to succeed. We want you to do well. And we're going to try and help you find that as well. So as long as you're a good student, you're a good person, you treat people well, you're going to be fantastic. And I think I'll be quiet now, let everybody else comment.
No, that was very helpful. Thank you, Dr. Schneider. Dr. Wernatzky, Dr. Stallings, any other advice you have for students, how they can make the most of their 4 years?
Yeah, I think, obviously studying and, getting good grades, like we were talking about, it definitely gets your foot in the door. If you have any interest in research, that's definitely something that people will look at on applications as well. But, finding places that you think you want to go and showing up early. I know you don't have that much time off when you're a student, but I can tell you on a number of occasions, I went to multiple different programs and, like I told you, 2 students just came this past week. And guess what? When those students go apply for externships and I see that their names pop up and I recognize their names, they're most likely, and I think most people would say these people already showed effort to come and visit the program because they were obviously interested in, will most likely end up with, an externship and spend a month with us. And so I think just doing things like that, putting forth the extra effort when you have abilities to do things. And I know not everybody wants to do things on the weekends, but when you have abilities in school, even, hey, there's an add-on case, or hey, this fracture came and it's an open fracture. You're talking to one of the residents and they say, hey, do you want to come in and see it? Go in and see it. That stuff goes a long way. And I don't think people realize that, putting forth that extra effort is just a little bit more than the next person, right? Goes a long way. And so these are ways that you can make yourself stand out when it comes to externships and getting a residency program. And Dr. Steiner's 100% right. The patients talk about you, the nurses talk about them. Like people will always be like, oh wow, I really like, even our MAs will be like, I really like this student. Where did they go? Oh, they're not with us anymore. Oh, I really, really like them. They were super helpful and, kind, etc. So you really have to realize that, when you spend a month with people, it's a month-long interview. And so that's kind of how I tell students is, yeah, your GPA may get you through the door, but how you perform during the month, whether you're a 4.0 or a 2.4, is really what people will judge you based on, because we've spent a month with you and I've had 2.4s come through and rotate and I'm like, man, that person is amazing. And everybody likes them and clinically they're great and they're smart and they're inquisitive and all this stuff. And, they get programs over people who have 4.0 GPAs. So.
We've seen that happen. Dr. Stallings?
Definitely agree with that. I'll keep this short and have this be like the advice that I would give for first year students coming in, because I get asked this question a lot. And my one piece of advice would be not to procrastinate. Seize every opportunity, every chance to better yourself, to get involved early. There's plenty of students like, oh, I'll do research third year. I want to focus on grades. Oh, I'll get involved with student government later, or I'll get involved with clubs later. And you're really doing yourself a disservice. There's no reason to wait. I got involved as soon as I got there and I don't regret it. And I think I could attest to every one of my colleagues or classmates that graduated who were involved with student government, who were presidents of clubs, who got on research their first, second, third year, and they're doing the best. So for the first year person, you're not too young, you're not too inexperienced. Just get in, get involved, ask for opportunities to be involved early. Don't wait. You don't want to be the applicant who's a third year, fourth year, who has this blank resume. You could have a GPA of a 3.8, awesome. But if you haven't done a single thing, you haven't made a single connection, it's a disservice to you, right? If you haven't spoken or shake hands with Dr. Bernatsky or Dr. Schneider, or as opposed to the person who did or who has the research, who's been involved, who's been to these conferences, you are doing yourself a disservice. So my one advice, hit the ground running in all facets, including the obvious of GPA, but in all facets.
Thank you, Dr. Stallings. It's very important. I know we're getting to the end of our webinar. We just have 2 questions. I think they can be answered fairly quickly. Do students use first aid for studying for the podiatry boards like MDDO uses to study for USMLE? Dr. Stallings?
That's exactly what I used. I used first aid. I used Kaplan. Oh, well, sorry, Kaplan's for the MCAT. I used first aid for part one, for sure, because part one is very similar. And then part two, we use board vitals more because it's a more specific with podiatric medicine, and those questions are written by the same people that write the questions for the boards. But first aid for part one and board vitals were the two things.
And NYCPM offers our students board vitals for free. The next question that we have is, when applying to residency, did you have to do clinicals during your rotations at these places in your third, fourth years of school?
So, yeah, so you don't have to. Some programs do make it mandatory to extern or do a clerkship at the program in order to apply for their residency program, and some programs do not. So I'd say the majority of the ones that people most likely end up at is somewhere that they did spend a month with. But you don't have to. Like for our program, for instance, we still interview people whether you came to do a month with us, spent a month with us or not. We would say, like, we would suggest at least coming to visit if you are serious about the program, because that gives you an opportunity to learn a little bit more about the place, see the hospital, see what we do, kind of meet us, which is, I think, is a little bit more informal, on top of the interview process. So you don't have to for a lot of programs, but it's definitely suggested if that's where you think you want to end up, that you would spend either time with them in a month or at least come visit.
Thank you, Dr. Bernatsky. Thank you to all of our panelists for your time and your wisdom, sharing of your knowledge. Thank you also to our attendees for, perfect, my alarm clock. Thank you for everyone, all the attendees for joining us as well. Have a good evening, everyone.
Thank you.
Thanks, guys.
Bye, guys. It's great seeing you.